Welcome to Care and Cure. I have with me Dr. Stani Francis, who's a specialist pulmonologist. Dr. Stani ഇന്ന് ഡിസ്കസ് ചെയ്യാൻ പോകുന്നത് bronchial asthma അതിനെ പറ്റിയിട്ടാണ് നമ്മൾ സംസാരിക്കാൻ പോകുന്നത്. Dr. Stani, thank you so much and welcome to Care and Cure.
Thank you.
Okay, doctor, like we mentioned, asthma, to a certain extent, ഒരു misunderstood ആയിട്ടുള്ള ഒരു കാര്യമാണ്. Like അതിനോടുള്ള stigma, doctor നേരത്തെ പറഞ്ഞു, asthma എന്ന് പറഞ്ഞാൽ തന്നെ പേടിയാണ് first.
People are very scared, when you tell them that they've got asthma, they're like, no.
No.
But I don't know, why are they
denial
scared? It's a denial.
Right.
And I tell them there are so many celebrities, who live with bronchial asthma.
Correct,
you might have heard about Amitabh Bachchan.
Yes.
He's asthmatic.
Okay.
At the age of 74, 75. He's still,
Yeah, he's still working and living a normal life.
David Beckham, the footballer.
Sports.
He's continuing with sports. And he's also an asthmatic.
Right.
So you don't have to worry that if you've got asthma, you can't play or
do
you
this
can't
or
indulge.
do that.
There's no need of any kind of restrictions. You can lead a normal healthy life.
Right. So, doctor, before we go into the details of what bronchial asthma is, can you explain what exactly is the illness? How would you define bronchial asthma?
Asthma is a condition, and basically what happens, your airways, airways get narrowed. Here I've got a model for demonstration. This is a normal airway,
Okay.
So what you see is, this is the space.
Right.
Air can enter in freely through this. The way a normal airway looks.
Normal airway.
And what happens in bronchial asthma is, as you can see here, there's hardly any space inside.
Space left, right.
There's this muscle spasm associated with, there's a lot of inflammation. You see, there is no place for air to go in through this.
Right.
So what would happen is, every time the patient has to breathe, there is no air coming in.
Okay.
So you would experience a breathing difficulty.
Okay.
Or breathlessness.
ശ്വാസമുട്ടൽ
And the reason for this is, the air is not able to pass through such a narrowed tube, This is the way it is supposed to be.
Right.
And what is happening is totally occluded. And you can even see, this is what you are seeing here, This white secretions inside. So all this together block the airway totally, and the patient finds it very difficult to breathe.
Okay.
Some patients, they just experience coughing. There's only dry cough, and this cough is usually
dry doctor. Will this be a
because what happens is secretions are very thick. So at times it becomes very difficult to bring it out. So what patients feel is just dry cough, and he knows there's something being stuck in, and he can't bring it out.
Okay. Or a tightness they can feel,
there's
right?
a tightness in the chest, And the characteristic symptom is this cough is usually more in the night or might be early in the morning.
Early in the morning.
And the reason for this cough being more in the night and early morning is the allergens. The cause for asthma actually is two, It's a combination of genetic and environmental factors. By genetic, I mean it's in your genes. You are like, if you're in your family, your parents, grandparents, anybody has got asthma, you are predisposed to have asthma.
Right.
But it doesn't mean that if my mother has got asthmatic, and actually my mom is asthmatic, but then I don't have.
You don't have it. Right.
So it's not necessary, but it's one of the, a person can be predisposed. If I'm exposed to a certain environment or triggers, I could develop the symptoms.
Symptoms of
asthma.
So
it's balance, or what do you say, combination of both genetic and environmental factors.
Yeah.
And now, if talking about environmental factors, it's like basically all your allergens. The most common allergen is dust. And I think it's universal. Dust all over the place.
World,
especially in your homes.
Right. Absolutely.
The most common places are your carpets, your curtains, your cushions, sofas, cushions, your beds, your pillows, your blankets, your comforters, they all collect dust, And what happens in the night when you're sleeping is you're continuously inhaling all this dust, which keeps on going inside
your airways,
contracting causing the spasm of your airways. And towards late in the night or early mornings, the patient would get up and start coughing. And you would start feeling breathless, And the reason for this is, one is the dust he's been inhaling the whole night.
Throughout the night, right?
Throughout the night he's inhaling. And there is a circadian normal hormonal changes going on in your body.
Okay.
Your steroid levels go lower down in the night.
Is that when you're sleeping?
When you're sleeping in the nights, the steroid levels go down. That's a normal circadian rhythm.
For any healthy individual.
Any healthy individual, the normal circadian rhythm, the steroid levels go down. And actually steroids are anti-inflammatory. So whenever you inhale these dusts or any kind of allergens, the body's response is actually defensive. it tries to prevent this dust from going inside, and that's why the airways are narrowing. Or there is a spasm and there is some, thickening, or what we call it is inflammation. So how do the steroids help us? They prevent this inflammation. They decrease this inflammation, so the narrowing will be lesser. But in the night, because of the circadian rhythm, your steroid levels are very low. Plus, you're inhaling all this dust, so this gets narrowed, and the patient develops the problem.
Breathing difficulty. Right.
This is one of the common symptoms with patient presence. He's like, I've got a lot of cough, and very classical history. That the cough is more in the night, early in the morning, or in the morning when I get up, there is a lot of sneezing. It's only in the morning. He'll say for first 30 minutes when I wake up, I've got a lot of sneezing. And after that, I'm fine. You take medications or you don't. He's totally like, fine. But then that first 30 minutes, he'll have a lot of sneezing because in the night he's been inhaling all those
the
allergens.
Dust and everything. So the body is actually trying to remove all of it.
Actually, when you're sneezing, what you're trying to do is you're taking out that foreign particle which has gone inside,
which is
irritating your nasal mucosa. So it's the body's defense. But in asthmatic patients, what happens? The body is a bit too defensive. What we call is hyperreactive. Normal reaction is just you leave it or something. But our body, or the people who are predisposed, their airways are hyperreactive. So though it's a small thing, they would totally go into spasm. They'll totally narrow, and because of which the patient experiences all those.
Everything is exaggerated.
Basically, allergy is a hyperreactive response or an exaggerated response of the normal response.
Right. Okay, doctor, now you mentioned genetic and environmental factors. Genetic, definitely, there's a limit to,
you can't change your genes.
You can't do anything about it. You have to put up with it. But environmental factors are something that you can maybe, or a limit to where you can control it or you can avoid it. So, UAE, how are these environmental factors affecting?
One thing I would like to advise is regarding your carpet, curtains, cushions, bed, because bed is a place where you spend maximum time. You're sleeping for around 6 to 8 hours in the night.
In a day.
So try to keep your beds, bed covers, bed and bed sheets and your comforters clean, dust free. Clean them regularly. Other thing what I would advise is, cover your beds with a bed cover during the day. Okay, you can cover your bed and your pillows with a bed cover. And just before going to sleep, you take it out.
Take it off. Oh, that's
so whatever dust would be there, it's a very simple thing. You have to just put a bed cover. So the bed and your pillows are covered. And
not exposed to dust.
It's not exposed to dust. And when you go to sleep, you can just, take it out. And regular cleaning of your bed sheets and blankets, and preferably in hot water, not in cold water.
Regular water.
Because you need hot water to kill those dust mites which are present. And good ventilation. Because natural sunlight is the best way to, kill these dust mites. And never let any kind of paper, books unnecessarily stack in a place. Because these books, papers, they all collect dust. And this again causes a problem. If you have got a tendency for asthma, don't keep pets at home. When I advise my patients, don't keep pets, they are like, in UAE, we can't keep pets at home. But then what I've noticed is you've got these pigeons which are coming into your balconies and sitting. And these pigeon droppings, they contain a certain protein which is allergic. So when you open your windows or your doors, these the proteins in the droppings enter the house and you are inhaling. And you don't realize you're developing. And you don't realize. You are like, if I ask my patients, do you have pets? No. And I would be like, do you have pigeons sitting? Yeah, they always come and sit. So that, you don't realize. You feel it's outside the house. But actually what it is, those things, when you open your windows, they're coming in and, causing a problem. So you have to take care of that. Then smoking. Smoking is a very common, active and passive. Both. So, even if you're not smoking, if anybody in your family is smoking, you advise them, either they go out or they stop. At least not in your presence, because that is a very common trigger again. Then cockroaches, a very common allergen. You see one somewhere around, the whole family is hiding somewhere. So it's very
unfortunately.
Because there's only one, but the whole family must be there somewhere inside. It must be hiding. So then do a regular pest control.
That's one advantage, doctor. Here we at least have the option of pest control. They do it frequently in most apartment complexes. It
but
is
then
taken
you have
care
to
by
be
the management.
doing it regularly. Just once in a year may not help.
Will not help.
And especially I think in this season, you have got a lot of cockroaches coming out too in the summer season. So you have to take care of that. Certain patients are even allergic to perfumes or certain smells.
strong smells, right?
Yeah, so you have to take care that, if you are having an allergy to perfumes or certain smells, to, avoid those things. And other thing I've noticed is, recently, like, I had a patient, I was talking to her about keeping a house clean, that you should not have dust in your house and all. She was like, yeah, I take lot of care. I keep on dusting it. I said, you don't dust it like this. This is not the way to dust it.
You're just spreading it
you're
everywhere.
just spreading it. Use a wet cloth to clean, that would be better.
Oh, very important.
You use a wet cloth to, clean your surfaces. And secondly, in this drive to be very clean, what they tend to do is they put a lot of antiseptic solutions, lot of chemicals into the water while mopping the floor. And that chemical itself causes a problem.
Is a trigger.
It's a trigger. So that also you have to take care, because there are patients who are like, we are cleaning it nicely, but the cleaning is with all these chemicals. Which are again causing a problem.
Not helping at all.
It's not helping, it's rather, and they don't realize what they feel is, they're trying to clean the house. They don't realize they're causing a trigger, And even certain foods, especially foods which are high in protein, like milk, nuts.
Oh, yes.
And in Western countries, peanut allergy is very common. So if you have
and also seafood, right, doctor? Some people
certain fishes, meat. More than meat, more than fish, it's meat because they contain high protein, which causes allergy. So if you have realized or noticed that, you have to, avoid these food stuff. And usually some people even have allergy to medications,
Certain medications.
Yeah, like aspirin, which is a common over-the-counter taken painkiller. But there is an entity called aspirin-induced asthma. Patients who take only aspirin, they develop they don't have any allergy to dust, no smell, no food, nothing. But only when they take aspirin they develop this, it triggers. So you have to be careful,
I think people have to be observant, doctor, to understand what is triggering asthma in me with all these.
Because for me, for a doctor to tell, like, you might, I said, when I tell somebody you might be allergic to dust mite, they're like, no. And then we keep on, digging the history. And then we come to the cleaning solution. And I might be asking for history for milk or something like that, and the allergy somewhere else. So the best person to tell you what are you sensitive or allergic to is the patient itself. So what you could do, or I would advise, is you can keep a diary, what all you have taken or whatever, maintain a regular diary. And when you have an attack, just see like what were the things you were predisposed to. That would help you in identifying the allergens.
That's a very good.
Because only the patient can tell what it is, what is he allergic to. For the doctor at times it is because there's n number of allergens in the environment. It's very difficult to pick up which one it is.
So doctor, having said all of these causes, I'm sure it's pretty common in the UAE, right?
Definitely.
Right now,
I think the incidence, I think there was some study done in 2015 or 16 which found out the prevalence as 11 to 14%.
11 to, that's pretty big.
Pretty high. That is in 1 in every 6 person has an allergic problem. So it's pretty common.
Right. Is this something that you can develop at a later stage? Now, I'm asking as a common person. Like, for instance, back in India, there are people who say, I was never allergic, and asthma, but after I moved here, I've suddenly seen all these symptoms. So is it something
actually, it doesn't have any age. Asthma can develop, or allergies can develop at any age. It depends upon the triggers. Okay, because back in India, the pollens, the environment is different. In UAE, you might be exposed to a different kind of pollen. In UAE, the pollen which is more allergic is the date one, the date plant.
Okay.
The pollens released by the date plant, they are causing a lot of allergies, So then in India, you may not have this date plant. So it depends upon the trigger. You could develop asthma at any age. Not necessary that, it's definitely common in childhood. Usually children till the age of 10, 12, they have these complaints. And gradually they outgrow it. But it doesn't mean that you can't develop asthma at the age of 40 or 50. You can have asthma at any age. Even at the age of 60, you might be, first time you might be having an attack. So it's not age bound. You can have the symptoms at any age. See, actually, it's a combination of genetic plus environmental. So genetic is already there. The environmental trigger depends.
So that can happen at any time.
It can happen at any time.
Okay, doctor, you mentioned all these allergens, the triggers that cause the allergy, right? Now, I might be able to figure, okay, dairy products allergy or dust allergy. But is there any clinical way to find out what is causing an allergy in a person? Some allergic tests
we have got certain tests.
Okay.
You have got allergy tests. But before going for the test, you have to do a few blood tests,
Blood tests,
yeah,
okay.
because you look out for your eosinophil counts.
Okay,
When you have an allergic tendency or you have an allergic reaction, your eosinophil counts are usually very high.
High, okay.
And then there's something called as IgE levels.
IgE levels, okay.
They are very high. So
Okay.
normally you do these blood tests to confirm.
Okay.
And we even do, if it is asthma you're suspecting and bronchial asthma, we do a chest X-ray also.
Okay.
X-ray in an asthmatic patient is always normal.
Oh, okay.
But still we do an X-ray to rule out there's nothing else. Because at times what happens, you're treating it as an allergy or as an asthma. And then after, sometime you realize the patient is not responding and you do an X-ray. It might be, pneumonia or something else. And you have been treating it as asthma.
Yeah.
So you even do an X-ray. These are basic tests which are done. And after that you can do a allergy test.
Okay.
And allergy tests, there are two types. You've got blood and skin. Skin prick test. Yeah, you can test, the blood is taken and you can test it for the various allergens. Other thing what you could do is on your skin, they keep multiple allergens. And it is judged which are you more sensitive to.
Okay.
So there are these two types of specific allergic tests. One is blood. It's
And
called
skin.
as RAST actually.
Okay.
RAST.
RAST.
Yeah.
Okay.
And the skin prick test.
Skin prick test.
These are two type of tests.
Right.
And this is for allergy. And specifically for bronchial asthma, we have got a test called spirometry or lung function test.
Okay.
In this, we ask the patient to blow into a machine.
Okay.
And the various parameters of the patient, like what is his capacity,
Okay.
that is judged.
Lung capacity is judged.
How much is his inhalational capacity,
Right,
how much is
yes.
his exhalational capacity.
Okay.
And we even come to know what is the severity of the disease. Does he fall into mild asthma? Is it moderate or severe?
Severe. Okay.
And we can even decide the response to treatment. After getting a baseline test done, we give the patient an inhalation with a drug, a bronchodilator.
Okay.
And then we see the response again. So
Right,
this would tell us whether the patient is going to improve with the treatment or not.
Or not.
So both the things we could decide, the severity of the disease as well as the response to treatment.
Response
both
to
can
treatment.
be judged by
Okay.
that.
Okay. So these are all the diagnosis methods. Is that right?
Yeah,
Doctor? Or is there anything else
No,
that will be done? This is
it.
This is it.
Spirometry is usually done to confirm. But actually, you don't need much of test to diagnose asthma, based on the history. The history is very classical, that, he's got this cough for a prolonged period of time, might be 2 to 3 weeks, which is not responding to the routine cough syrups. And more in the night or early mornings. And then he would himself tell you, I had this something cold or, I went somewhere. And
trigger factor,
and, and it is increased. So history is very classical. To examine the patient, he might have rhonchi, that is sounds in the chest.
Okay.
So these things would, so based on your history and physical examination, 80 to 90% cases you can tell that, this patient has got bronchial asthma. But he need a documentation. That's the only reason you can't, just, start giving the patient
medicines.
treatment. It's always better to have a documentation. That's the reason you do a spirometry or lung function test to prove that, it is. And this is what is the grade of severity.
Correct.
That's the reason.
Doctor, does asthma manifest differently in children versus adults? Common symptoms?
There's not much of a difference actually in children and us. But children can't speak. They can't tell you that I'm feeling a pain or heaviness in the chest or there's difficulty in breathing. The children can't express it. Adults can express that. No, there's some heaviness in my chest. I'm not able to breathe. My nose is blocked. But children are not able to speak. So what now you notice is that usually children are very playful. So when you notice that the child is not playing and his breathing rate is increased, or he might be coughing. This would be the indicators that he might be having a problem, or he might be having a running nose, which is quite evident. So this would be the indicators that the patient has got a problem. So you take him to a pediatrician or a pulmonologist and get him examined. Because compared to adults, patients many a times they are not able to children are not able to express
what they're
going
going
through.
Adults
immediately they'll realize that something is wrong and they'll go to a medical practitioner, but children are not able to express. You might just notice a running nose or something, and he's not playing, or he will not be eating food properly.
Correct. And sometimes parents can think, running nose, it must be just a cold, and cold they might not.
That's another thing, what I think we all try to be doctors.
Exactly.
Because, we feel that, this is not a big thing, just, simple. So you give some home and everybody's got, some advice, you try this, and some home remedies and all that, and they will try it out, and then when it worsens, when you realize the breathing is increased, that's when you take the child to a doctor. So it could have been avoided, It was started with the nose. If you had treated it then, might be it wouldn't have gone lower down.
Exactly. That too for a child.
Who can't even speak, this is what is wrong with
Right. Okay, doctor, it's time for a short break, but before that, I just want to ask you one last thing. In case of all these symptoms, is it better to directly approach a pulmonologist or a general practitioner or an ENT? That is also a cause of concern.
It's better to approach a pulmonologist directly. Because he would be able to, guide you better. Because many times even many doctors are not aware about what is asthma, what medications are to be given. They know what are the medications, but the correct way of taking the medication is also very important. Because the way the treatment for asthma is slightly different from your other conditions.
Illnesses.
We don't normally prescribe tablets. What is prescribed as inhalers. So the way of taking it is different. So the understanding that technique is very important. So it's always better you go to a specialist than a GP for this.
Absolutely. Right. All right. Great. So we are in conversation with Dr. Stani Francis, but do stay tuned. Cheriyoru break aanu. We'll be back with Care and Cure. Welcome back to Care and Cure. എന്നോടൊപ്പമുള്ളത് Dr. Stani Francis ആണ്, specialist pulmonologist, and we are discussing the topic of bronchial asthma. Doctor, before the break, you'd mentioned about the various tests that a patient can do. Bronchial asthma ഉണ്ടോ ഇല്ലയോ, severity ഒക്കെ determine ചെയ്യാൻ. പക്ഷേ ഒരു ഡോക്ടറെ അടുത്ത് പോയി ടെസ്റ്റ് ചെയ്യുന്നതിന് മുമ്പ്, is there a way to find out for a patient himself or herself how severe the attack is? Like, can they take a count of the number of attacks? അങ്ങനെ എന്തെങ്കിലും ഉണ്ടോ?
Definitely. You could, if you have one thing is you've got this cough, which is not going in spite of your routine
cough
treatment.
Syrup and medicines.
You are having difficulty in breathing.
Right.
You are not able to sleep in the night. You have to get up, multiple times in the night, and you are coughing, or you feel this tightness in the chest. There are sounds coming. And the frequency of this is like more than twice or thrice a week. And that means you are having an attack.
And it's severe.
It's a severe attack. And when it's a severe attack, the patients even can't complete finishing one sentence. The attack is that bad that, what we are now talking in paragraphs. At a stretch, the patient may not even be able to say, I want water. Even these 3 or 4 words will not come at a stretch. It's very difficult for the patient to talk to. This means he's an asthma and he needs to be rushed to
the hospital immediately.
Definitely.
Right. Okay. Now, once the patient has come to the hospital, we test and we've determined that he is an asthmatic patient. How does the treatment begin, doctor? What is the first step?
The treatment for asthma is different from your, other conditions.
Right.
In other conditions, what you have is you have got these tablets, which are very easy to take. You have to just swallow it. It goes into your stomach. It spreads through your circulatory system. Into the, wherever the problem is, and it's over. But in asthma, we don't normally give, tablets. What is prescribed is something called as an inhaler. I mean, inhaler is a drug or medication which acts locally. For example, when you have got an eye problem, you put eye drops. You've got some skin problem, you put an ointment. In similar way for lungs, when you have got a problem in the lungs, the medicines which are prescribed, these are called as inhalers for asthma. But I don't know why the people have got a lot of fear of taking these inhalers or they're like scared, like addicted to it. But I really don't understand why are patients scared of addiction. These drugs, they don't contain morphine or codeine. They are just simple bronchodilators. They are drugs which will just open up your airways. Which are just narrowed. It will just open
them up.
There's nothing to fear. You have, patients are having hypertension. Because, you've got blood pressure, you've got diabetes. And they're very comfortable taking medicines for years together. They will never ask a doctor, I'm taking it for 5 years. Will I have an addiction? They don't ask. But when it is an inhaler, I don't know why they're like, will I get addicted to it? I don't know why there's so much of stigma,
associated.
But rather it is the safest. Because when you're prescribing tablets, the dose of the drugs in milligrams or gram. It's like 500 milligram or a gram when you're taking tablets. But when you say take the same drug in an inhaler form, the dose is in microgram.
Oh, okay.
So you imagine the amount of drug going in is also very less.
Very less.
And it is taken in the inhalation. It's usually in a form of a pump. So you just press and the medicine goes through your breath directly into your lungs, into your airways where the problem is.
Right.
So the one thing is the side effect is less. Okay. And second, the action is fast.
Fast.
If you take it a tablet, you swallow it, it will go to the stomach, and then by the time it reaches the lung, it will take at least 30 minutes to 1 hour, and it goes all over the body. The tablet doesn't know it has to go to the lungs. Right? It is not directed. You have to reach the lungs. Okay, don't go anywhere. There's nothing like that.
True.
So there are more side effects when you take tablets. But when you take these inhalers, they are very safe. You have to just press the pump. But the technique is very important because many times, since it, unlike as I said, it's not like a tablet. Tablet is very easy to take. You just put it into your mouth and it's over.
It and it's done.
It's done. But with inhaler, you have to inhale it and hold your breath.
Okay, there's a specific technique.
There's a specific technique where you have to take it. So the technique has to be followed. And if your technique is wrong, again the drugs won't be working. And you'll be wanting, I'm pressing this 5-6 times, still nothing is happening.
No effect.
There's no effect.
Right.
So the way or the technique is very important, the way the drug is taken. And there are two types of inhalers. You have got relievers and preventers.
Okay.
What a reliever does is, this narrowing which I said, it would immediately relieve this narrowing, this spasm or this contraction, it will open up the airways.
Right.
Okay, so these are your relievers. And we have got preventers, which would decrease the attacks or the frequency of the attacks. And these are steroid-based drugs.
Okay.
But you don't need to worry about the side effects at all. I would like to tell my viewers, please don't be, worried because people are like, steroid.
The minute they hear that word
steroid, they are scared. But there's nothing wrong. I mean, it is in a very minute dose. It's in microgram. And it's acting only locally. So you don't need to worry at all. So both these drugs are usually prescribed.
Right.
And they would relieve you of your attack.
Right. So these are to be used together, doctor? The relievers and the preventers?
Usually we give them together. And one short-acting one is always given to a patient, a short-acting reliever.
Okay.
So that in case in time of a severe attack, you can immediately take it. It would relieve the attack. Because the preventer won't open up your airways. It will just prevent the attack. So you need a reliever to be taken immediately when you are having an attack.
Okay, right. Now, besides all of these external interventions, doctor, like all said and done, medicine is something that is externally given to induce the or reduce the incidence of attacks. Is there something that the patient can himself or herself do to reduce the varanda? Is there something that a patient can do?
As I said, mentioned earlier, it's like you have got two components for the cause.
Okay.
One is genetic and second is environmental.
Yes.
Genetic, you can't change.
Nothing can.
You can't change your parents. You can't change your genes. Second is environmental. So all the triggers I mentioned earlier, like dust and pets, all these things you could avoid. Other thing is we live in UAE where most of the time we are indoors with these ACs.
Yes.
And since now temperatures are very high, so your ACs are functioning all the while. The humidity is high. So what happens, there's a lot of moisture in your AC ducts too.
Ducts itself.
And this moisture would cultivate molds and fungal elements which are thrown into the room.
Into the rooms.
So you have to take care that your AC ducts are cleaned or maintained regularly.
The filters are cleaned.
That's
as needed.
important. You could do that.
Right.
Then smoking, you should not.
Just stop it. It's
Stop
unhealthy for many reasons.
It's
not just for asthma.
Definitely. It even affects your heart. It even affects your GI system, even your bladder.
True.
So, it affects each and every system in the body.
Correct.
But the commonest one or the first one to be affected is usually your lungs.
Your lungs, right. Doctor, we have a caller online. Hello? 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 Hi, welcome to Care and Cure. Aara vilikkunne?
Aju ആണ് ഷാർജന്ന്.
Aju from Sharjah. Okay, Aju, you can talk to the doctor. സംസാരിച്ചോളൂ ട്ടോ.
എന്റെ വൈഫ് ആസ്തമ ആണ്. ഒരു 10-15 years തൊട്ടാവും. ഒരു വീക്ക്ലി വൺസ് ഇൻഹേലർ ഒക്കെ യൂസ് ചെയ്യാറുണ്ട്. ഇപ്പോ അവിടെ ഒരു 3 months pregnant ആണ്. അപ്പൊ ഈ പ്രഗ്നൻസിയിൽ ഈ മെഡിസിൻസ് യൂസ് ചെയ്യാൻ പറ്റുമോ? ഈ ഇൻഹേലർ യൂസ് ചെയ്താൽ വല്ല കുഴപ്പമുണ്ടോ?
There's another fear which people have got.
Right. I think we were just about to discuss this. It's also as a part of our discussion. Aju, nammal parayunnundu ട്ടോ, doctor parayunnundu, ketolu.
Okay.
Yeah, Mr. Aju, he should not stop the medicines. And what I would like to tell you is the dose or whatever she was continuing earlier, the same dose has to be continued even now. Because the mother has to remember that the child is totally dependent on her for the oxygen. the child doesn't have any lungs or any mechanism of getting oxygen. So the mother is, I mean, the baby is totally dependent on the mother for oxygen. So if the mother develops an attack, there would be no oxygen and the baby's condition would get compromised. So it's very important that the mother continues her medication at whatever dose she's been advised. She should continue throughout her pregnancy and not stop the medication. So Mr. Aju, please consult a pulmonologist, and if she needs any medications, those medications have to be continued. Please don't stop the medicines.
That's the recommendation.
കുട്ടിക്ക് വല്ല പ്രശ്നം ഉണ്ടാവോ?
ഇല്ല, കുട്ടിക്ക് പ്രശ്നം ഉണ്ടാവില്ല എന്നാണ് പറയുന്നത്. കാരണം കുട്ടിക്ക് ഓക്സിജൻ കിട്ടുന്നത് അമ്മയിൽ നിന്നാണല്ലോ. അപ്പൊ അമ്മയുടെ ഓക്സിജൻ അവിടെ കോംപ്രമൈസ് ആവുകയാണെങ്കിൽ അല്ലെങ്കിൽ അത് കുറഞ്ഞു പോവുകയാണെങ്കിൽ ബ്രീത്തിങ് ഡിഫിക്കൽട്ടി കാരണം കുഞ്ഞിന് അപ്പോഴാണ് അത് എഫക്ട് ചെയ്യുക.
You don't need to worry about the baby at all, Mr. Aju. If the mother is taking the medications regularly, the baby would be totally fine. It's only if she doesn't take, the baby might get compromised. And whatever drugs she is taking, it's not going to cause any harm to the baby. There is not going to be any kind of side effects, or the baby will not be born with any kind of congenital abnormalities because of these drugs. So you're not totally safe. You don't need to worry at all. And there are a lot of studies and research which has been done, and they have proved that it doesn't cause any harm to the baby. So if the mother is taking the drug, it is not going to affect. Only if she doesn't, it might cause a problem.
Okay, Aju. But doctor പച്ചക്കൊടി ഉണ്ട് ട്ടോ. Don't worry. Okay. Thank you, Aju. Thank you. Bye. I think this is something very, very critical.
Yeah, because I don't know why the patients feel that, we have got pregnant and they're, I think, worried that it might affect the baby. Yeah, but it's not. Rather, if you don't take, it's going to affect.
It can be
because
negative.
How is the baby going to breathe? The baby doesn't have any respiratory system. The baby doesn't have any respiratory system or any way of inhaling. The only way the baby is getting the oxygen is through the mother's blood.
Through the mother, right.
So if the mother's airways get compromised, if the mother's airways are narrowed, there's no oxygen going in, the fetus, the baby would also not be getting any oxygen. And then there might be a problem. So one thing is, before the patient is planning a pregnancy, it's advisable that you consult a pulmonologist too, and get your treatment optimized.
Okay.
Whatever, in case you might be feeling your asthma is under control, so you don't need to take any medication. But what is always better, you meet a pulmonologist and get a checkup or whatever test done to confirm that it is fine, and then can definitely go ahead. And if the doctor is doctor is advising inhaler, please do continue in the same dose what has been advised throughout your pregnancy.
Okay. And is there a need, doctor, during the course of pregnancy, during the gestational period, is there a need to frequently visit the pulmonologist, like a follow-up visit?
It's not actually needed unless the person is having any trouble. It's not needed. You can just continue with your gynecologist. In case you feel there's a lot of cough which is not responding, or you've got any nasal allergy, sneezing, running nose, or something like that, then you can visit. But if you don't have any complaints, it's absolutely fine.
Absolutely. You can continue with the same medication.
If you're having complaints of difficulty in breathing, cough, any nasal complaints, then you should consult. Otherwise, there's no need.
No need to consult. So it's absolutely safe for a pregnant woman to continue asthmatic medications, the inhalers and all of that.
It's totally safe. There is no side effects at all.
Okay. And after the pregnancy, doctor, is it necessary for a re-evaluation?
Not needed. If the mother is fine, there is no need for a re-evaluation again.
Nothing at all.
If she's fine. And other thing about asthma is these attacks are triggered. I mean, between these attacks, the patient would be totally fine.
Fine. Normal.
Totally normal. Yeah. So if there is no attack, the patient will be fine. So there's no need, actually to consult. Only if you're having a problem, then you consult. Take the medication and continue with the medication. And if you are an asthmatic, it's advisable at least once in 6 months or once in a year you consult your pulmonologist.
Okay.
So that,
like a review.
So because then in case the dose needs to be modified, either increased or decreased, it can be done.
Okay.
Because many times what happens, might be some change in environment or certain lifestyle changes the patient must have had. Might be earlier she had pets and now she doesn't.
Does not.
Few certain changes might have decreased So then the dose also can be decreased. So for that, once in 6 months or once in a year, you can. Like you have your cardiac checkups. I think people are like, very particular, that you need a cardiac evaluation, you need to get your cholesterol done.
All the diabetes, all those are very promptly
people
done.
are very particular. But lungs, I think nobody is bothered. Or the awareness, I suppose, is not that.
Very, very true.
You don't realize. But they don't realize that because of the lungs, they are alive. That's the organ which is giving you oxygen.
Right. Absolutely. Okay, doctor, earlier we spoke about how an asthmatic patient can lead a normal life. സോ എ കോമൺ ക്വസ്റ്റ്യൻ ഒരുപാട് ആളുകൾക്കുള്ള ഒരു സംശയമാണ്, ഒരു ആസ്മാറ്റിക് പേഷ്യന്റിന് വർക്ക്ഔട്ട് ചെയ്യാൻ പറ്റുമോ, ജിമ്മിൽ പോകാൻ പറ്റുമോ, എക്സസൈസ് എനി കൈൻഡ് ഓഫ് ഫിസിക്കൽ ആക്ടിവിറ്റി ചെയ്യാൻ പറ്റുമോ?
Definitely. Asthmatics can definitely exercise. As I gave you an example of the David Beckham is a footballer and he's still continuing with his sports activity. He's not stopped. The only thing you have to take care of few things. If you are predisposed, there's like something called as exercise-induced asthma. The patient doesn't have any symptoms otherwise. Only when he does some physical activity, there is an attack of asthma. In such conditions, you take your inhaler, 15-20 minutes before you're planning your physical activity, and then you can continue the normal way. Okay, there is no problem. And other thing is you have to take care is you don't exercise in cold environments, because in cold environments, when this cold air enters into your lungs, it again irritates the airways, and that would itself induce an attack. So you have to take care that, like for example, there's activities like your ice skiing and ice hockey and ice skating and all these activities usually we don't advise to asthmatic patients, because in such environments the attacks might get triggered. But otherwise your routine whatever, swimming is very good.
Swimming is good. Okay.
You can play basketball, football. All these short bursts of activities would do good. Because exercise is an important part of health.
Absolutely.
Healthy lifestyle. So you can't
Overall
stop.
health,
You can't just stop exercising because you're an asthmatic.
Right.
So you have to continue with. I mean, you can continue with your exercises, but just take care that in case you have a problem, you can keep your inhalers with you handy, and just take a puff.
Right.
15-20 minutes before the activity.
Right. True.
And other thing is just don't jump into the activity. You have a warm-up period.
Very, very important.
You have a warm-up period, then you start your activity and then gradually cool down.
Cool down,
That's the way it should be done.
True. Ideal
ideal
of working out.
Just because you're an asthmatic, don't restrict your children from physical activity.
True.
Because many mothers are very worried,
Unnecessarily worried.
My child is asthmatic, so I will not let him participate in this sports day or running or whatever those competitions. They are very hyper, but I will let them do. So the child himself starts getting depressed because he's not normal. He's not being allowed to, mingle with the other children just because he's asthmatic. But you don't need to worry. You can let him continue with his activities. Just give him the inhaler before 15-20 minutes before the run or whatever activity
he wants
to do, and he can lead a normal, healthy life.
Absolutely. So I think the takeaway today, doctor, is that even an asthmatic patient can lead a normal, healthy life.
Definitely.
Absolutely no restrictions.
No restrictions at all.
Okay, great. Thank you so much, Dr. Stani. It's been an absolute pleasure talking to you today.
Same here. Thank you.
I hope you guys enjoyed today's Care and Cure segment. Adode Care and Cure avasanichirikkanu, and that brings me to an end to Women's Era as well. I wish you all a very happy and healthy weekend. Sunday, njan ivide undavum. Until then,